show for the a own side. So they move from generation. Then another one wey fit cause dyslexia, I say person hit him head for something, or you hit the head with something, or the brain gets injury. Let's say as our body they get injury like this, the brain self get some kind injury. Wey be say you no go see the pain the way they walk. You don't wunjure the brain in your language. You don't wunjure the brain as you take the walk. You know. So those kind of things, if you cause those kind of things, say for instance, all this knock wey dem go say that I will give you knock, you go reset your brain. That knock will be true. If you knock person for the side of the brain wey dey responsible for this language area, if the thing is so severe, wey be say e make the brain shock, the thing fit affect how the person go read, or how the person go develop reading skills, especially children. Make we avoid anything wey be say they use hit their head, or they use cane, they do tospit for the pikin head. They never start to, but the tospit the cane for your head. All those kind of things fit make the person brain dey shocked in that area of language. So anything wey fit make person hit him head for something, or hit the person head with something, those kind of things fit cause dyslexia.
Conk, that one where they conk pikin.
They tell you now, all that conk wey dem go give, wey go reset your brain. That kind conk no good though.
Okay. All right.
Make you avoid that conk.
Now don't they hear that because some of na so conk na sabi conk. Pikin wear something worry am. Dyslexia. Thank you, sir, for this lecture. My nephew's twins boys are 4 years plus. One of them have ADHD. He can sing alphabet rhymes but can't talk, while the other is not talking yet but makes sounds. Though both of them started working at 9 months. Please, I would like to know if it is dyslexia or autism, though they are undergoing therapy at the moment. Peace from Aja.
Make we react straight.
Yes, please. Na question.
Okay. Peace from Aja. This your question. Abeg, how we don't know the pikin age?
They say they be 9.
They develop.
They be 4 years.
4 years, okay.
Yes.
4 years, okay. Is it very important say you don't pay attention to all these children to know wetin dey happen to them? So I go advise you strongly, since you say that they go through therapy. I don't know the kind of therapy that they go through, you know. And you say one day ADHD, get ADHD.
Yes.
I don't know how they take the assessment, but the first thing I say, allow them go through that therapy. If not professional, they manage them. If not be professional, bring them from our center for Lekki. I don't know, make I give our address?
No, that one much later. What we done the round off. For now, make we just take more questions.
So please, if you bring the pikin, then the children come our Lekki center, or you go call our number, we will go give out later. With that numbers, we will tell you how we will fit attend to you. But if you say then they go through therapy, it's fine, provided say na the right person. Now help them go through the therapy.
Okay, good morning, Dr. Anuzo. My 9-year-old son gets speech delay. I don't carry him go hospital, and I was told to do some tests, after which I was told that I should take him for speech therapy. He can write from 1 to 1,000 on his own, but only the speech. Okay, and he can calculate very well too. Mommy Moturayo, could this be dyslexia?
Well, speech challenge itself is another issue, but if he be a pointer, if he the pointer and go say this person will develop dyslexia. But with speech challenge, a different issue on its own. Since you need it, I don't know, maybe it go there very strongly advisable, make you get the speech therapists who will work with you. But make I just give you 2 quick exercises where you go to do, where fit help the pikin with speech. A very common one where some people don't know say they help with speech. You see blow and they blow. Blow, they help develop speech because they help with the mouth muscles and the muscles where you go need to produce sound. Blow, they help. Blow of different sizes. Give and the one you be saying go need blow more air, you be saying go need is small where you go need push air out. Then the one you be saying they bigger. Then you see straw of different sizes. Give and straw making they sip in water or they sip drink. You see these 2 exercises help and maybe make the person also the moving tongue around. These 3 things fit help in developing speech, and it will help strengthen the muscles of the mouth. Because if the muscles of the mouth, if then they're weak, like plantain, we don't overripe. You know, go fit use and produce speech. But if then get strength to fit move, speech go fit come out. But I go advise you, you go meet a speech therapist who go further guide you for the things where you go need to help your pikin, or you call us, we go help you too. But this sign too fit the point say na dyslexia. The earlier you begin to pay attention, you call us, we go help.
One more question, Dr. Abege. Wetin be the difference between dyslexia and autism? I mean, they related.
Okay. Dyslexia, we talk am say na language challenge. Na language. Autism na social interaction problem.
Okay.
Person wey dey autistic fit dey talk, but he no know how to fit express himself. Go meet people, say, oh, give me your motor, I wan use am play. Oh, how wetin be your name? You no know how to talk, say, hey, your clothes fine, oh, hey, I need water. All those type of things wey be say person and person go dey do together to fit dey achieve anything. They no go fit do am. So a social interactions challenge wey dey affect in so many areas of their life. Their processing speed, that is the time wey e go take for them to talk something and respond. They really dey affected by that. But dyslexia on its own na a language on challenge wey dey affect reading, writing, comprehension and pronunciation. Dyslexia fit go join body with autism. But you no mean say anybody wey get dyslexia also get autism. You no also mean say person wey get that autism get dyslexia. But the two fit join body. When the two join body like that, you go need a specialist to fit identify the one wey dey challenge or to provide the type solution.
Okay.
You know, so the two they different, but then they a bit closer if you look at them very well. Because now with language, you go fit initiate interaction. If you and person want talk now when you sabi talk, you go fit do them now. But if you don't know the language to use, it will be a challenge. So then get one small line we join that dyslexia and autism, but they totally different. But they fit go together too.
Okay, so Mr. Moses still there here inside the studio via Skype. And don't forget www.facebook.com/Wazobia Radio. Now there if you watch us live on top and Facebook 0700-951-951-951. If you get questions on top of this particular matter we will talk about, feel free to ask your question. Hello, good morning to you.
Hello.
Morning, no. Morning.
Good morning, GMG again.
Welcome.
Thank you. See, Auntie Law, I want to ask him. There's this girl in my children's school. She's a big girl. At least she should be around that kind, 12, 13. But the girl is in primary 3 with those small children. She's very nice, though. But you find out that she'll be playing with those children. And I asked the auntie one day, the auntie said that, yeah, she doesn't do anything though. Even all this 1+1 that we are teaching herself, she cannot write it, but we are just managing her. So I'm asking now, that kind of a child, is it still good to leave the child in the school, or you take the child to go and do something else? And I want to ask, if is this problem that is happening to this child? That is my question.
Okay. Mr. Moses, are we good to go?
Yes, ma'am.
Okay.
Now you see that's speaking. They deal with many things when no be dyslexia alone. I don't meet somebody where they 42 years old, where they GSS 1. 42 years old, they GSS 1. And so you need to understand, say, this thing where they talk, maybe just say it will affect any age. So that speaking, they deal with so many challenges, so many things join body where they affect them. So we need that kind of pikin go need an assessment to know the kind way where they go use approach them. If you carry that pikin, say, come out and for school, make him go learn something else or go do something else, that pikin no go fit do well for there because the problem, they never solve them from the foundation. So if you carry and come out, say, make him go they learn this one, unfortunately, that kind of pikin, they feel they abuse and there. Not those kind of pikin, they go they abuse, they no go fit talk. You go see them, so many things go happen to them, nobody go fit, they no fit talk, say, see wetin happen to me. And if somebody tell them, say, if you talk, I go kill you, that one no go fit talk anything. So that kind of child, he no need say make you carry and come up for school. That school environment, even though you know they benefit 100%, the pikin still they get some small things when they get. But to make them benefit 100%, we go need carry am do assessment, then we go tell people wey go dey work with am how dem go work with am, then tell dem things wey dem go dey do to fit help am dey fit meet up with im mates and to pass all those small small children play wey im dey play.
All right, we go buy this market, and when we come back, we go definitely continue. No touch this style. Or being a physical one, or being a, the entire well-being of each, or any family member. Okay, and then today na dyslexia and I would look at today, and then we get a psychologist will be say in core area, and mind, brain, and cognition now being focus area on top this psychology matter. Okay, and that now Mr. Moses CHUKWUEZE in inside the studio here with us via Skype. Okay, the answer all our questions them on top of this matter. We don't talk plenty. He don't talk about within dyslexia be. He don't talk about within ficosam. He don't talk about the some types of dyslexia way dey. He don't even talk about how the thing take fit pass from one generation to another generation. Mama, papa fit pass and grandparents fit pass and give grandchildren. Okay, and all that. And you also don't talk about when you notice some signs and where you go see and make you carry your picking go assessment. So if you get questions where you go like to ask, don't forget to 0809 5975 808. Now we SMS and we WhatsApp number 009 5975 808. Now we SMS and we WhatsApp number. Until good morning. My son at the age of 10 can't wear his slippers rightly. What is that one called? Chika from Ejigbo. Say no sabi wearing slippers right there and he's 10 years old. Could that be dyslexia?
Yes, so na coordination issue. If they point to dyslexia, yes. I forget to talk that one self. Sometimes people don't differentiate between left and right. Maybe you tell them say up, down. If you move, you go right. If you move, you go left. Those type of coordination issues and direction, they also point to dyslexia. So that pikin wey dey deal with coordination issues, some they go where they are, as she take talk, button itself, they go button anyhow. So those type of issue fit dey point to dyslexia.
Okay. All right, so this other person wey dey here. Messages, so hello Jehovah. Okay, Uzo, can age of 20, 30, and 40 years be assessed? Okay, from K2. So whether they feel assess person we don't reach 20, 30, and 40 years on top dyslexia.
Yes, so we fit. The assessment, remember we talk say dyslexia fit affect anybody from 1 to even 99.
Okay.
So the assessment too, they as individual take the grow. They go fit assess wetin be the challenge and help you.
Okay. Good morning, Uzo. My son is 8 years old, but he's always forgetful, unable to understand mostly his English subjects. Blessing from Ijai. Could that be dyslexia?
Well, we no go fit talk say all these things will be dyslexia because some of them learning issues too fit come. See, this person wey no dey understand now, if the foundation of language build am well, then if you dey go higher, e go become a challenge. So some of them fit no be dyslexia, e fit be say the foundation of language dem no build am well for them, will make them dey struggle in later life. So, but however, the ones wey be dyslexia, even these ones wey dey always get this type of language challenge, we also fit identify them. E dey point out to a need, make person pay attention and help them grow over it, and things they will fit help them to get over this type of challenge.
All right. Good morning, please. What can I do? My daughter is 5 years. She's in grade 1 and she reads very well. And she's always feeling lazy when it comes to writing. Lola?
Okay.
Is that a symptom?
Now, it fit not be symptom, but the thing be say, for your pikin wey dey feel lazy when it comes to writing, one of the things we go even talk along the line, I say if you dey make them write, no write too much. Give them something simple where dem go dey write. Gradually, if they move from simple things, you go dey increase the number, but no give them plenty things to write. In pikin wey dey age 5 and grade 1, these are still formation age, where we say they still dey learn how to do all those things. So if you dey pour too much on them at the same time, go easy for them. So now step by step, you go dey fit dey help that kind of person.
Okay, aunties, on my 8-year-old niece can't wear her pants by herself. She acts like a 2-year-old. Now, symptom be that? Could it be a symptom of dyslexia?
That one fit not be symptom. Make them teach am. That one fit dey deal with other type of thing where they worry am, but no be dyslexia they push to.
Okay. Hello, good morning to you.
Hello?
Good morning.
Hello?
Good morning.
Good morning.
Welcome.
I want to speak with Mr.
Moses.
Moses.
My name is Moses.
Good morning.
Go ahead, please.
I want to ask. Like that time when we did school,
Okay.
if they read, you don't understand, or they teach you something, you don't understand, they say you should drink that so that your brain will calm down. Is it true? Like, is it any food or beverages where you go eat, where you go make your memory stay high?
They say make you drink wetin gas. Now you talk.
Gary.
Gary. Okay.
Yes.
Now your question be that.
Yes.
All right. Mr. Moses.
Yes, ma'am.
Right.
The thing be say, some of those things na the things wey dem use bubble us when we small. Say if you do this one go happen. Those things feel no correct. Those things no dey science. Dey science. So for some people really, to improve memory, because the thing na something we say deals with behavior, get some strategy where you go fit use to fit help you improve memory, or maybe they read something they forget, or maybe during exam time everything we read go be like say your brain don blank.
Just wipe off.
Get some strategy, like exactly like I said, they just clean am. Get the way that they prepare people to be able, as you learn to read, you also learn to remember. You also learn to store the thing where you don't read. All these things now step by step, people know. Some people feel no sabi am do. Some feel sabi am do, maybe say nobody teach them, but they just sabi am. Meanwhile, some people no sabi am at all. So, but some people they fit help them do all those things. But if they take anything, like maybe for a higher level, they will tell you some drugs they help improve memory. If you take all those drugs to improve memory, if you do this strategy, those behavior things where if you do, go fit still even remember all those things. So all those food they say, eat this one. If it help you for other issues, but for memory, if you practice, the only simple strategy where we say most things they help with now, you need to find the way where you're going to do the practice of the things where you need to do. If they don't teach you how to do the practice, even if you take all the whole food, eat all those things, go do well. But some people, they feel they nervous. People say, they worry them, but then cool down, they go get the thing.
Okay. My daughter is 7 years, but can't read 4-letter words. If she writes alphabet, she writes small b as D. She likes play a lot, especially small children, but she's intelligent. She likes addition more than reading. She doesn't like school.
Now, why that pikin no like school? People say her reading experience for school, they make her feel pain. And anything where you feel pain, you go run away from her. So that pikin, if they deal with dyslexia, that could be a major sign of dyslexia for that pikin wey be say, you remember I talk say then they change letter.
Yes.
The woman talk say they write B for D. That one are a major sign. So that pikin go need a quick assessment to know wetin dey be the challenge and to provide further help for am.
All right. Morning to you.
Hello, good morning.
Good morning.
Please, doctor, morning.
All right.
Good morning,
So now, yes, I want to ask. My name is Rocket Pastor
Okay. Where they call us from?
from Ikeja.
All right, sir.
Is it anything that the parents can do first before they carry the pikin come meet you? Which way can we follow up first? You understand what I mean? So if you notice something like that, they get any kind of food where it's supposed to they give them, or so that they'll build up his whatsoever.
Okay.
Before we carry and come meet you. And what will be the what that they do for the pikin? Because you say no medicine for it. Then how that they do and make the pikin come understand all these things?
Okay.
Okay.
Thank you.
All right, Pastor. All right. Mr. Moses.
Thank you, Pastor. The thing what they do, they call them, would they rewire the brain? You know, if you go carry your motor, go someplace, they'll tell you they will rewire your car, rewire. The brain, would they rewire the brain using scientific strategies? Maybe say, we know they give drugs, we know they give any, you know, go put the brain for machine, make them do anything. Now, strategies where the pikin go they do, as you go they do them consistently, the thing will help build the brain and the skills. Now, science supports that one, and it's very obvious. We they do them plenty. Now, for house, if you see, say, the pikin don't they do this thing, the first thing I go advise now say, do record taking. Record taking now say, everything where you they observe, make sure say they put them down. Maybe if the pikin, you send a message, in they forget change, just put that one down, say, in they forget change. If not say in they read, in go understand small, then sometimes in no go understand. All those things, take a record so that if they can't see us, you go tell us to see the record where you see for house. Before we will come talk assessment, before we will come ask teacher, we don't teach them, say, waiting be the record where you see for school. Before we will bring everything together, because the assessment will put all the information together to point to the right direction. Meanwhile, if time allows us, I fit tell us some things where parents feel they do, they help their children for house.
Okay. I beg, if you talk am now.
Okay, the first thing I say, you know, dyslexia, with the talk I'm saying, a reading problem. So parents, try to help your children improve in sounding of the letters. How letters they sound. As they house with you, they help them make them they sound those letters. One important thing where you go do be say, if then they get reading problem, not attach any punishment. Not tell them say if you no read, you no go talk. If you no read, you go wash plate. If you no read, we go flog you. Come out punishment for them. If they like to read, say they want lie down, then lie down for bed or sit down for couch, they read, or for chair. Leave them, make them read that position. Any position in which they choose to feed it for house to help them understand. Leave them, make them they read. Then you get what they call sight words. For instance, cup. All those small things will be 3-letter words where you go see for house. Cup, watch, pen. All those things, practice them with them because those kind of sight words, they give them difficulty. So when you practice them with them, if it's put cup in the midst of phone or wire, tell them making identify the things there. You go identify, it's okay, this one now cup. All those things they call them sight words and how to identify them. They engage them with story. Tell them, make them talk story. And if you watch smart, you go tell them, okay, make them talk story of what they understand. You go to see the missing, the things where they miss, you go feel help them, they add the thing. That one, they also help they build comprehension, you know. So anything where they want to read, no give them plenty things to read. Now the problem and the mistake where most people they make, even for school, anybody where they struggle with reading, making no start reading with plenty things. The more the thing plenty, the more it gets confusing. Even the small way the pikin know, you know go fit do them again. So start with small passages, small short things where the pikin feel they read. Then if you read them, you go they feel they ask some small questions. Just tell and say, okay, make him talk about them. From there, you go to help and they build comprehension.
All
so
right.
Will not take too much of time.
Okay. Thank you, Mr. Moses. All right, to go buy this market. And when we come back, we will just come answer some few questions and we go wrap up because 4 minutes now remain before 12. Go stand attention for Inside the Studio here. mind, brain, and cognition. You can also watch us live on top Facebook, www.facebook.com/Wazobia Radio. And this morning on Top Family Clinic, we did talk about dyslexia. Okay, and somebody there say, "Good morning, Auntie Zo. I have a sister that is 38 years old. She has been battling with this condition, but my parents did not identify it earlier. It was when they are old that I realized it wasn't a spiritual problem. They were taking her to prayers, and they were taking her for prayers to different churches. Portia from Agodo. Now the person will send that one enter inside here. Wow. So as I make her ask, how long did this time whether they stay inside, whether they stay or the how do I put it now? The treatment, the solution one that they do, the therapy, yeah, that's the word. How long the therapy they last? The therapy one that they give them, how long it they last? What will be the duration?
Okay, it is different according to individual. Say some people, I thought say their own fee be small, some you go dey well, some you can't dey plenty. So depending on the person own assessment results, go talk say if this person fee dey 3 months, if you go dey 6 months, if you go dey 9 months, if you go dey 1 year, if you go dey come to the center, it depends. Now the result will tell us how long the person go dey for the center or the process where you go work with.
Okay. All right, so good morning, Atuzo. Please, if is it everyone who hardly comprehend when reading that suffered from this dyslexia? What part of the brain does it affect? William Evergreen, all the way from Lekki. Everybody we know sabi comprehend.
No be everybody we know they comprehend they deal with dyslexia. No. That's why we dey talk say dyslexia and other things we go together. Comprehension issue is different. You don't get some adults we come to us if not just comprehension, and we help them improve their comprehension in short time, in weeks and months, and just continue with their life and be really productive. So no be comprehension. Every time person they deal with comprehension, I see na dyslexia. Now the part of the brain, that one a big science. If I call the word here, and I feel no understandable, so we could just leave that one. We could leave that word, but they get for the brain, then get language area of the brain, then get the part of the brain where they responsible to save everything where they hear in terms of your memory. Then you get another part of the brain where they help you draw those things come out. So science get different name for them. Some they call them bronchial area, some hippocampus, some the cerebral cortex. All those things like that get different names. So if we call all those names, if we confuse plenty people here, so we don't want to do that one.
All right. Somebody say, wow, that's a cool, and that's cool. This topic is very interesting. Dyslexia and similar learning differences stem from innate patterns of thinking and learning that are associated with high levels of creativity and strong problem solving and three-dimensional thinking abilities. Aha! Moses Jeremiah. Oh, then this one my people go say Bajiri chalk.
Yes, sir.
You break it chalk.
Serious chalk.
Okay. People still want talk. They have plenty questions. They've seen there plenty messages and see here, but we know if you continue again because 12 o'clock down the cut eye they give me for here. Time don't reach for me to come out for inside the studio here. But before we go, people who don't identify this some of these symptoms. If they won't come for assessment, you don't see they will go for assessment, or they when I feel come meet them. Now they also do house to house kind of assessment for kids and also therapy.
They do remote, not be house to house, remote assessment.
Oh, remote. Okay. Break them down for
people. If you do your house, I do my house, we do the remote, we do the assessment.
Okay, virtual. Now go do video call. Okay. So if they want to contact you, how far?
Yeah, so if you want see us, come for Dyslexia Foundation, 5B Adekule Faji Crescent, or Folute Crescent, or Fadeni Jones. The simple number to call now 0808 323 1926. I think I call the number again.
You go call us small.
Don't forget. Okay. The number to call now 0803, no be 8, 0803 323 1928. 0803 323 1928. That one our Ikeja Center. For anybody ready for that Lekki side, if you go our Lekki Center, 17J Freedom Way, off Ikate bus stop. From Ikate bus stop in Ofa. The number to call there now 0814 039 1262. 0814 039 1262. If you follow us on social media, Dyslexia Foundation, for Twitter, at Dyslexia NG, for Instagram, Dyslexia NG, for Facebook, we did there, Dyslexia NG or Dyslexia Foundation, you will see us. If you also check my name, Moses CHUKWUEZE, for Twitter, for Facebook, and for Instagram, you will see us there. So anytime, anywhere you just get to us, somebody will speak to you. Or if you want to speak to me directly, you'll let them know. They'll tell you how you can take get me.
All right. Thanks a bunch, Mr. Moses. Thank you so very much as you branch today. We don't steal your time, Wella. Okay, God go bless you very plenty. Thank you so very much. All right, so you don't get the number 0803 323 1928. 0803 323 1928. Now the number where if you call to get more information informate or take your picking, go assessments. Anyhow, where you want to take therapy and all that, you fit reach out to them for there. Okay, thanks so much all of now. We don't stick around with me since 6 o'clock. Hi, we're not too much. We're gonna take order. Kuruna Boris them. Okay, we go do this again next Saturday by the special grace of Abagode. Okay, same time, same station, 95.1 Wazobia FM. I still remain your one and only Uzo Ododoba. Somebody where they asked me make I spell dyslexia for them. DYSLEXIA. 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 All right, I leave you for the hand of Roboskin Jada. Roboskin Jada. All right, go carry you go. Ontop, make we talk. No touch this style.